Thank you, Mr. Deputy Speaker. I want to rise today and say that I fully support the motion by the member from Regina Walsh Acres. But before I get to that, I seriously want to talk about hypocrisy. Day after day, members opposite stand in this House every single day and demand more funding for health care. And what do? They support a federal Singh-Trudeau coalition budget that does not fund health care. That is hypocrisy upon hypocrisy.
Yep.
All premiers in this nation have consistently asked for funding for the Canadian Health Act, and I am going to, at this time, walk through a bit of the history of the Canadian health system and how important this is. Mr. Deputy Speaker, health in Canada was traditionally a commodity where patients paid their doctor at the time the service was provided. So if we go back historically, that was how the healthcare system was designed and developed. And then this, of course, is pre the famous movement by Tommy Douglas' government, but in 1929, the government of the day under R.B. Bennett, Dr. Kenneth Mackenzie spoke on the issue at a medical services conference, saying, if there is an evil, there must be a remedy, and that remedy, as I see it, must be some form of distribution of cost among the people at large. So back as far as 1929, well before Tommy Douglas, there was conversation about what the cost of health care is in this nation. The first Hospital Care Act was designed and developed in 1946, as all members know, and the Saskatchewan Hospitalization Act was developed, and it guaranteed full hospitalization coverage paid for by the government for every resident. But it's interesting that in 1957, the Hospital Insurance and Diagnostic Services Act was passed, and this system was financed 50% by the federal government. 50%. We have to come back to that 50% number all the time, because ever since then, provincial governments have argued that the agreement was 50-50. And as we all know, that has never been the case since. So shortly after the then Premier Tommy Douglas introduced the Act, it's interesting that the very next Premier, Woodrow Lloyd, almost immediately decided to mess it up. Typical NDP policy. So when the Saskatchewan Medical Care Insurance Bill was introduced in 1961, they, of course, immediately complicated it and created a doctor's strike in early 1962. And guess what? In typical NDP fashion, they chased out doctors out of the province. In fact, about 10% of all doctors in the province left the province in 1962 because of NDP policy. And the strike didn't last very long, but it was a very, very unfortunate reminder of how bad the NDP are at managing health care in this province. And in fact, shortly after that, it was left up to communities across the province. Local citizens groups opened medical clinics and hired doctors to work in them. The Medical Care Insurance Act, or Medicare, was introduced in 1966. And that Medicare allowed each province and territory to initiate a universal public health care plan, and this system is still in place today. But in 1984, the Canada Health Act was passed, and that was the plan that prohibited extra billing. So I want to go on and say that, just remind everyone in the House that The medical health system is a single-payer public health care insurance system, and it's financed through the tax system. The members opposite, members of the money grows on tree policy party, I think that's clearly what they believe. They think that money comes for all of these things. Just as I say, it grows on trees. So obviously, there's no problem with supporting the Trudeau-Singh budget because the money is just there. Don't worry about it. So the single-payer system is financed through the progressive tax system, and Saskatchewan, of course, was the first province to establish universal public hospital insurance, and it's important to just remember that particular point because there's much more to the health system than hospitals. I just want to step ahead to in 1984, the Canada Health Act was developed, and Canada's federal health care insurance legislation codified the national principles which underpin federal funding for hospital and physician services. It's important to note that the provincial and territorial governments have primary jurisdiction in healthcare administration and delivery. This includes setting their own priorities, administering their healthcare budgets, and managing their own resources. The federal government, under the Canada Health Act, defines the national principles that are to be reflected in provincial and territorial health insurance plans. But I want to state again that the provincial and territorial governments have primary jurisdiction in healthcare administration and delivery. And if we skip forward a few years, before I get to that, I just want to say the public administration criteria pertains only to the administration of provincial and territorial health care insurance plans and does not preclude private facilities or providers from supplying insured health care services as no insured person is charged as long as no insured person is charged in relation to the provincial provision of health care services. So, Mr. Deputy Speaker, that's a review of the Canada Health Act as it stands today. So, it was under the former NDP leader's leadership that the incursion into provincial territory really began. The Romano report, which was struck, really left the provinces wanting because it's kind of been since the Romano report was tabled that we've seen the federal government year after year in budget after budget after budget incur more and more, step more and more into provincial jurisdiction. And the result of that, of course, is what we get today is that with virtually every piece of healthcare funding, there are strings attached. And we know that when it comes to the federal government, those strings usually have significant consequence to the provincial government. And we've seen that in virtually every ministry, but in particular in healthcare, where they design and develop some theory of what healthcare should look like across this country, not recognizing for a second that healthcare in Saskatchewan is vastly different than healthcare in downtown Toronto. And I think that that's one of the things that we need to keep reminding the federal government and, of course, the Singh-Trudeau coalition that healthcare in the provinces is extremely challenging. It's extremely different from province to province and from region within province to other regions in the same province. And we need, as a government in Saskatchewan, we do an incredible job with our healthcare support, and the people in the healthcare system are unbelievably dedicated people. But we need the flexibility in the healthcare funding model, and we need the full 35%, despite what the members opposite support. So, thank you, Mr. Deputy Speaker.